Hello, I'm Angela Davis, and today I'm going to be performing a comprehensive pediatric assessment. Can you tell me your name?
Preston Davis.
And how old are you, Preston?
I'm 11.
It's very nice to meet you.
Nice to meet you too.
So I'm going to first start by washing my hands. And now that my hands are washed, I am going to get this assessment started. We have already done your vital signs. They were all normal. You had no fever. Everything was good there. I would like to thank you for your cooperation with your vital signs. That made it easier. It's always good to have a well-behaved child in the assessment. However, sometimes there are other techniques you have to use, such as sitting on a parent's lap or something like that if you have to do an assessment, but you are perfectly behaved child. So in regards to your general appearance, you appear well nourished, you had no fever, you're in no distress. Your weight from last year to this year has gone up by 4 pounds. However, your height has also gone up 3 inches. So you're growing, everything's been plotted on the growth chart, and you are in about the 95th percentile for both height and weight. Did you know that?
No.
Well, now you know. So I am going to begin the initial part of your assessment by assessing your head and neck, okay?
Okay.
So I'm going to note the symmetry of your head and facial features. So I'm going to check for any masses or abnormalities. So if I look at your head, I can see that your head is round. There's no abnormal shape or masses. I'm going to ask you to remove your glasses, please. And if you can just look straight ahead. So I'm just looking at the symmetry of your facial features. Everything looks symmetric. Next, I'm going to move on to checking your lymph nodes. So if you just look straight ahead, I'm going to check preauricular, postauricular, tonsillar, and I'm just going to keep moving forward, submental, and then I'm going to check along your sternocleidomastoid. So you do not have any swollen lymph nodes. That is excellent. So we are going to move on to checking your eyes. So you wear glasses. We have them off for right now, but we had already done your visual acuity on the Snellen eye chart, and with your glasses, your vision was corrected to 20/20. So I am going to check for the corneal light reflex. So I am going to shine a light about 2 feet away from your eye. So I'm going to ask you to look straight ahead, and I'm going to look for the light, and it's in equal areas. Look straight ahead for me, please. And it's going to be just slightly nasal, which it is, so that's good. Then I'm going to next look at your eyes, your conjunctiva. So I'm going to touch your face, so you can just look straight ahead for me. And I'm going to pull this down so I can look inside. That looks good. And I'm going to look here, look straight ahead. Perfect. And then I'm just going to check your pupils, look straight ahead. And your pupils do constrict to direct and consensual light, so that's a normal finding. That's good. Next, we're going to check your eye movements. So I'm going to have you follow my finger with just your eyes, okay?
Okay.
All right. So you see my finger?
Mm-hmm.
Just your eyes. Very good. And then I'm going to have you touch your nose. Touch my finger. Touch your nose. You're so quick. Very good.
I touched it twice.
That's okay. Very good. Next, I'm going to move on to checking your ears, okay?
Okay.
So, I have my otoscope. So, what I'm going to do is, I'm going to ask you to scoot over just a little bit for me. Thank you very much. I'm going to pull your ear up and back, and you're going to feel this go into your ear, okay? And I'm just going to check for any signs of inflammation or infection. Your right ear looks very good. Oh, your left ear. Your left ear looks very good. So now let's check your other. Can you put your head straight for me? Thank you. Very good. No signs of infection in either ear, so that's good. I'm going to check your nose. So I'm going to check your nasal passages, okay? So just look straight. So I'm just going to take this light and I'm going to just like look up your nose, okay? Oh.
I can't do that. Okay.
Very good. I'm going to come on this other side. You got a little bit of clear drainage in your nose, but no signs of chronic allergies or anything like that. The mucosa is a normal color. Next, I'm going to check your mouth and the back of your throat. So I'm going to ask you to look straight ahead again. And then I'm going to ask you to say, ah, and then stick your tongue out for me and say, ah. Very good. One more time.
Ah.
Very good. All right. And now you can put your tongue, can you lift your tongue for me? Very good. So now I'm just going to assess the inside of your mouth and then move your tongue to the left. Open real wide. And look at the top of your mouth. And I'm going to move over here. You can move your tongue to the right. And then I'm going to just look at your teeth. And do you go to the dentist regularly?
Yeah.
Good. And do you brush your teeth every day?
Yeah.
Good. And do you eat nothing but fruits and vegetables?
No.
So that part is finished for your mouth. I didn't see any ulcers, any signs of infection, anything like that. Your mouth looks good. And then, so next I'm going to put this down and I am going to do what's called a whisper test. Okay? So what I'm going to do is I am going to cover one ear. You can look straight ahead. And I'm going to move this around and I'm going to whisper a word. So I'm going to do that. I'm going to whisper a word and then you're going to tell me what it is, okay?
What happens if I get it wrong? What would that show?
That would mean that you might need a higher level of hearing test.
Oh.
Okay.
So, don't fail.
All right.
Don't fail.
You ready?
Okay.
All right. You look straight ahead.
Zebra.
Oh, good. All right. Look straight. Do it with his hand.
Cactus.
You whispered too. Very good. So yes, you got those. That was good. I wasn't sure if you were going to hear that cactus. So all of that is very good. It was a very good assessment.
Nice.
So next I'm going to move on to your respiratory assessment. Respiratory means your breathing assessment. So I'm just going to watch, I would watch how you're breathing to make sure you're not in any respiratory distress. I would just watch the pattern of your breathing, the depth, make sure you're not using any accessory muscles. And normal breathing is a 1-to-1 ratio. So I can see that you're breathing very normally. That's good. So now I'm going to listen to your lungs, okay? So I'm going to grab my stethoscope. Can you take a deep breath? Doing great. Very good. So your lungs are clear. There's no wheezing. There's no adventitious breath sounds, which means like extra breath sounds, bad breath sounds. So your lungs sound very good. Next, I'm going to move on to listening to your heart. Okay. So do you know where your heart is? Very good.
I know now.
Yeah. All right. All right, so your heart sounds good, nice and strong. If I would have heard a murmur, which is Still's murmur, which can be a very common in childhood, I would have you lie down, sit up, and then stand up, and then listen to your heart at those intervals to see if I can still hear it. So it can change with position changes, but your heart beat is normal.
In this position.
I am going to check your pulses in your extremities. So if I can see your arm, I'm going to check your radial pulse here. And I'm going to check your radial pulse here on this side. Both strong. And I'm going to move down to checking the pulses in your feet. Dorsalis pedis. And I'm going to check on this side. Very good. So next we're going to move on to your abdominal assessment, which is your belly assessment. So I'm going to ask you to put your arms at either side, and then I'm going to ask you to bend your legs a little bit like that. Perfect. So what I'm going to do is first lightly press on your belly, and I'm going to check for masses, tenderness, and distension. Right now your belly looks flat and it's symmetrical. I don't see anything obvious. You have no scars. You have a couple of freckles here, but no scars or rashes or anything like that. And we'll get to your full skin assessment later. So I'm going to press on your belly starting there. Okay, and then I'm going to move on to deeper pressing, okay, deeper palpation. Almost done. You're very ticklish, huh?
Yeah.
All right.
Handled that like a pro.
So the next part of the examination can be a little bit awkward, right? Because I have to examine your penis and your scrotum, right? So you would never want anybody else to look at that unless it was a doctor, or if you had an injury and you wanted your parents to say, "Oh, take a look at this," but you should never let anyone else look in that area, right? So I would start with warm hands. I'm going to warm up my hands, and I would work my way down, examining the inguinal canal. Um, just as I would with an adult, I would work my way down, and then I would assess your penis. I would see if you're circumcised or uncircumcised. I would make sure that there was no rashes, no inflammation, no lesions, nothing abnormal. I would check the skin color. I would make sure that it's not, abnormally large, because that could be a sign that there's something wrong. And then I would check your testes. I would make sure that they're fully descended, not distended. I would make sure they're fully descended into your scrotum. And then rectal exams are not routinely done on children after a certain age. But if you had any abdominal issues or anything going on that needed to be assessed, I would perform a full rectal exam. Next, I'm going to move on to assessing your skin. And so what I'm going to do is I'm going to start at your head. I'm going to part several areas, just checking the texture of your hair, the distribution. You can lean down a little for me. I'm just checking different places, making sure there's no abnormalities. I'm going to check the skin on your face, making sure that there's no lesions or anything, which is good. Checking the skin of your upper torso, just a few freckles, no rashes. I'm going to check the skin of your arms. I'm going to check the temperature. And then I'm going to check capillary refill in each fingertip. All right, I'm going to move over to this side. I'm going to check temperature. Check your capillary refill here. And then I'm going to check your legs. Check your temperature. And then I'm going to check your capillary refill. And those toes. I'm going to check. Your feet are a little bit cooler than the rest of your body. I'm going to ask you to stand up so I can look at the back of your legs. You can turn that way. So I'm just going to look at the back of your legs. Check the temperature. And then I can see just a few freckles here. Looks like a couple scratches here, but no bruising. Very good. You can turn around and sit down. So overall, your skin looks good. It's normal in color. I do see that you have some change in your skin tone, which I assume is from being in the sun.
Yeah.
And do you use sunblock?
Sometimes.
Okay. Well, you should start using it more often, okay?
Okay.
It will help prevent problems when you're older. All right?
Alright.
All right. So next we're going to move on to assessing your musculoskeletal system. So I am going to ask you to stand up. So we're going to walk this way. And then I'm gonna watch you walk from behind. Okay. I'm gonna ask you to stand over here. And can you touch your toes? Good. And then can you turn to face this way? And then can I have you bend over and touch your toes and stay there so I can assess for scoliosis. So I'm just checking your spine. Make sure it's straight, and it is straight. Okay. And then can you walk on your heels like this?
Oh, I did this all the time.
Okay, good. And let's walk on your heels back this way.
Running away.
All right. And then can you run over there and then run back? Very good. Yeah, very good.
Regaining consciousness.
And then can you hop on one foot?
It's better if I can spin around.
And then can you do it on the other side?
Yes.
Very good. You can stop.
Okay.
All right. So lastly, I'm going to check your joints and check your strength. Okay. So can you give me your hands? Can you squeeze my hands? Can you pull me towards you? Can you push me away? Very
That's
good.
harder.
So you're strong. So I'm just going to check the flexibility of your wrist. Here, just let me do it, okay? Good. I'm going to do it on this side. All right. I'm going to do your feet. Bend your knees, relax. All right. And sorry, can you stand up one more time? I should have checked your hips, and you're going to turn. And then I'm going to check your, to make sure that your hip doesn't drop. So I'm going to have you just stand on your right foot. Good. And then stand on your left. Good. And then you can go ahead and sit down. So I think you're very strong. Your joints seem good. Mobile, right?
Yeah.
All right. Oh, let me check your neck. I'm going to ask you to turn your head and then turn it to the left and then straight and then down and then back and then all the way back. Good. All right. So you have full range of motion of your neck, so that's good. Very good.
Oh, it cracked. That felt nice. Well, going crazy. It felt nice.
All right. The last part of your assessment is going to be checking the neurological assessment. We have done several of those things already, like when we checked your cerebellar function. Remember when I had you touch your nose and then touch my finger?
Mm-hmm.
And then I checked your eye movements. The one thing that we will do is I'll check your peripheral field of vision. And I'm going to test your sensation now. So what I want you to do is I'm going to have you close your eyes and I'm going to touch your face with something, okay? And then just tell me if you can feel it.
That's soft.
Okay. Can you feel me touching?
Yeah. It's still soft.
Still soft? Feel it there?
Yeah.
Good.
Still soft.
Okay. You can open your eyes. So I'm going to check your visual field. So I want you to look straight. And I want you to tell me when you can see this object.
No.
Good. Look straight ahead.
No.
I feel like you looked to the right. Let's do that again. Look straight. Just keep looking straight.
No.
Good. Okay. So I want to check your rapid finger movements. So what I want you to do is you're going to take your hand. You're going to go like this. Yeah, that's okay. All right. Do the other hand. Good. And then I'm going to just check your fine motor skills. I want you to copy what I just did. Very good. Another thing I could have had you do is draw a picture for me, like a person, and then we could discuss your drawing so that I could assess your language further. But I've been listening to you talk, and we've had a conversation throughout our whole examination, so I can tell that your voice is normal, you have no slurred speech, everything sounds good. So.
Okay.
So we have already checked your muscle strength when I had you squeeze my hands and pull me towards you, push me away. I saw you run. I saw you walk. I saw you go on your heels. I saw you bending. So very strong, very normal muscular tone. So the last thing that I need to do is just check your reflexes. So if I can just have you scoot back a little bit. All right, and just relax, okay?
Okay.
Don't look. Okay? All right, so those reflexes are good. So that will complete the pediatric comprehensive assessment. Do you have any questions for me?
Can I put my glasses back on?
Yes, you may. I would like to thank you for your time today.
You're welcome.
I hope you have a lovely day.
I hope you do too, Mom.